Ambrose Dlamini has become the first Prime Minister to die after testing positive for COVID-19. His death comes 4 weeks after testing positive for the coronavirus. The Prime Minister of Eswatini died on Sunday afternoon in a hospital in South Africa. No cause of death was mentioned, but Dlamini had recently been receiving treatment for COVID-19 in South Africa. Dlamini had been Prime Minister of Eswatini, formerly known as Swaziland, since October 2018. His death comes as countries begin to receive and await receipt of COVID-19 vaccines. Joining us live from Kenya is a radiologist, Dr. Tengan Ndiame, who's here to talk to us about what to expect from the vaccines. Thank you very much for joining us, Dr. Ndiame.
Thank you for having me.
Now, with the infrastructure on ground in most African countries, experts are anticipating a slow distribution across much of which will be a setback given the infrastructure deficit, and that some of these vaccines, all the vaccines need to be preserved in a certain temperature, which might be challenging to a lot of African countries, providing given the lack of infrastructure. How do we overcome this setback, as it may be?
Well, as you correctly said, there are challenges in regards to infrastructure when transporting the vaccines. However, I believe that these are challenges that we've overcome before. And for example, when there were the distribution of the PPEs, I think it was quite effective in most countries. We're able to still deliver the PPEs even to the most rural areas. And as we know, infectious diseases are not new to African countries, and therefore the cold chain, the cold chain distribution is already in set on the ground. I think the biggest challenge will be how do we transport the vaccine from outside countries into our country. And for example, our country, Kenya, they've already set up a pharmacy area within the airport. That's the JKIA airport, that will be able to store the vaccines at really low temperatures, at about negative 23 degrees.
There are talks of a second wave in Nigeria. South Africa is also considering tighter restrictions amidst a surge in cases. How guarded should we be now that we're approaching a festive season, which a lot of people consider a potential super spreader period?
That's true. The festive season is a super spreader period, as seen in other countries. For example, in the US, when they had their national holiday, there was a surge in the infection rate. So we should be very guarded during the festive period. Which the restrictions should still be in place. We should not let go of the restrictions until we have brought the infection under control. So the second wave has been shown to be even more deadlier than the first wave. And in other countries such as the US and the UK and in Germany, they actually had to go into a second lockdown. And therefore, we should not put down our restrictions yet. We should still be able to keep the infection under control.
Now, Dr. Ndiame, there's the Pfizer-BioNTech vaccine. There's also the Russian Sputnik vaccine. And a lot of good news are coming out when it comes to development of vaccines. The Chinese also reporting 95% efficiency. Is there any African country or African-led vaccine initiatives that has seen the light of day? Any hope coming from the continent in terms of developing an indigenous vaccine?
Well, not yet. We do have a vaccine initiative such as CAVI within the country. However, most of them still work in conjunction with outside vaccine initiatives. I'll give the example in Kenya. We have the vaccine that was discovered by Oxford was actually tested within our country. And so I think that's the role that we've played so far in the development of the vaccines. Yeah.
Now, it's been an unprecedented period. A lot of people have never gone through this sort of pandemic in their life, and news of the development of vaccines gets them excited. So I know you don't have a crystal ball in front of you. You're not a prophetess, but can you give us a time frame now that Western countries have developed the vaccine, when life might just go back to the way we used to know it before? Because, yeah.
Well, it's very hard to tell because different countries will have different vaccination rates depending on the infrastructure, as you said, and also depending on how fast they'll be able to procure the vaccines. With the cost of the vaccines itself, will the patients have to buy, or will the government actually distribute the vaccine? So there are a lot of factors to consider before saying when life will actually go back to normal. Yeah.
Thank you very much for joining us in News Central, Dr. Ndiame. We do appreciate your insight on the subject matter.